Does anybody have a favorite saint, physician saint story to share before we begin?
Well, I'm going to tell you, Giuseppe Moscati, number 9. There's actually a movie you can get from Netflix on his life. Very, very good. And when I saw that, I go, oh my gosh, I'm a terrible Catholic physician. This man gave everything, he would sell his furnishings and just give them money. They didn't pay him. He gave them money because they were so poor and couldn't afford medicines and whatever. I'm like, wow, if that's what a Catholic physician, I'm very far from being a saint. So you can rent that. You can get it through Netflix, I believe.
Is that Italian with the English subtitles? Or
Might be.
You can also,
What year did he live?
there's the Form
I think
website
like
that St. Rex has to go for, and it's free
15?
on Form.
18.
Oh,
Thank
so St. Basil, or no, Blaise didn't make the top 10, huh?
This is just my list,
Oh, okay.
but tell us about St. Blake.
Well, St. Blaise, of course, I think we probably all know this. Once a year we get our throats blessed with the candles, and apparently there was a boy eating a fish or something like that in ancient times. I'm not sure exactly when, whether it was Renaissance or before, and was choking on a bone, and St. Blaise somehow was able to get the bone out and make sure that. So that was.
St. Blaise a priest or a physician?
I don't even know if he was a physician or whatever, but he saved that boy's life, so that's the act of a physician, I guess.
So these are not all physicians, but when I was preparing for this talk, Gloria asked me a year ago, so if you ask somebody a year in advance, you don't have any good excuses for next year, so I said yes. And I looked at the history of the church, or the history of medicine and the history of the church as much as I could in the time. And what I'm hoping you can get an appreciation from the talk today is how our church has shaped the formation and the history of medicine. We're kind of going through chronologically here, but also how medicine has allowed us to practice our faith. So, to start at the beginning, instead of St. Luke, we're going to start with Jesus. But to set the stage where Jesus came into medicine in his time, there were physicians and there were hospitals in Rome, but there was not this mandate to care for the sick or the poor in a universal health care, if you will. So the hospitals were for the soldiers and they were for the slaves in Rome, and the Greek temples were where people presumably would go to be healed, but the poor and the sick were not necessarily cared for. So physicians did practice euthanasia and they practiced infanticide, with the exception of those that had taken Hippocratic oath. So Jesus kind of comes into this scene and he cures people. Here's our miracle where he cured the lady with the hemorrhage. And he tells his followers to help those that are sick. So in the parable of the Good Samaritan, you're helping a Samaritan who a good Jew would be speaking to, and you're helping him out. And then when Jesus sent forth and he commissioned his disciples, he also, this is Matthew on the bottom, he gave them authority over unclean spirits to drive them out and to cure every disease and illness. So he did give this commissioning to his disciples and his followers, and they did actually follow what he had said. I'm going to stop here and mention that Luke, the evangelist, was also a physician. And in that story of the woman with the hemorrhage, he is the only gospel that gave the anecdote. She had gone to many doctors and had spent all her money. And he also, if the story of the camel fitting through the eye of the needle, he is the one that uses a surgeon needle, the word for that, instead of a sewing needle or whatever. So in the early church, the Christians did care for the sick, they cared for the poor, they brought them in their homes and took care of them. And maybe your best history is from your critics, but I believe Julian the Apostate was trying to bring paganism back into Rome and win back the hearts and the minds of the people. He was advised to build a hospital and pay for it with public funds because the Christians were winning this court of public opinion through their care for the sick. And some of those early physicians, this is the twins Cosmas and Damien. They were in Arabia. They were called the moneyless ones if they get in charge for their services. And the story from Cosmas and Damien, miraculously, they transplanted or grafted a leg from an Ethiopian man who had recently passed away or deceased to a Caucasian man who had to have a leg amputated from an ulcer or from a malignancy. So that's a miracle told about them, but they lived in a time of persecution. So they were martyred during the Diocletian persecution in 287. If you come into the next century, in the 300s, with Constantine, Constantine, we had your Edict of Toleration of the Christian faith, and then Christianity became the official religion of the Roman Empire. And if you come into 325, the Council of Nicaea, after that it was started to build a hospital in every cathedral town. And then councils after that went into the size and kind of specifications about your hospital that you're supposed to have with your cathedral town. And if you move forward to the 700s, the Holy Emperor Charlemagne said you should also have a school attached to every cathedral and monastery, and the school would be where medicine would be taught as well, to the point of that monastery. This is not a physician, but a saint who was instrumental in giving the rule, which ruled monastic life. Benedict of Nursia, born in Nursia, educated in Rome, but he left Rome to be a hermit, to live a solitary life in Subiaco. But people came to him for his sanctity. So there's a story in Subiaco. This is the front of the medal of Saint Benedict, and there's a cup and there's a raven. So when he was in Subiaco, this group of monks or hermits needed a leader, so they asked him to come be their leader. But it didn't turn out so well, so he had these men who, they may pray, they may do this, they may do that, and he said, no, we need to have some order to our life. You need to obey. If it's time for prayer, everybody's got to come pray. And this wasn't well received, so the attempt was made to give him this glass which had wine or what have you that was poison, and Benedict must have been aware of this, so he prayed over the glass before he would drink it, and the thing cracked. And so he didn't have to not drink it, and he also didn't have to get poisoned. There's also a raven over there. There is a loaf of bread under there. Same thing, somebody else sent him a loaf of bread that was poisoned, and he handed off to the raven, which I guess would come to visit him and ask the raven to take it somewhere that it would not hurt somebody. So that's in Subiaco. He also got other followers that he taught kind of how to live in monastic life. He left Subiaco, went to Monte Cassino, which was closer to Rome, not so far away, and there was built the monastery of Monte Cassino, and this is where he formed his rule. And his rule in relation to healthcare, here I have chapter 36. It says, before all things and above all things, care must be taken of the sick, so that they will be served as if they were Christ in person. For he himself said, I was sick and you visited me. And what you did for one of these least ones, you did for me. But let the sick on their part consider that they are being served for the honor of God. And let them not annoy their brothers who are serving them by unnecessary demands. Yet they should be patiently borne with, because from such as these is gained a more abundant reward. Therefore the abbot shall take the greatest care that they suffer no neglect. So this rule this is just part of it. There's a longer one. You can actually get it online. It's kind of interesting. The monks would memorize the rule, and it's not too hard to read the rule of St. Benedict. But this would give a rule for monasteries that were formed through Europe, and most famously the monastery of Cluny in the 1900s, or pardon me, in the 900s, would go on to reform Europe. Also the Benedictine monastery, which he formed at Monte Cassino in the 900s to maybe up to the 13th century. The texts that were stored there were the basis for the school of Salerno, which is the oldest medical school in Europe. Going from the 500s, we're going to jump to the 1000s. This is Hildegard of Bingen. I am not an expert on Hildegard of Bingen. There is another movie called Vision, also subtitled, but you can get it from Amazon Prime if you want to see a video on her. But she is a very accomplished Middle Ages lady. So she was an abbess, she was a mystic, a visionary, she was a writer, she was a composer, she was a philosopher, and she is credited as the founder of scientific natural history in Germany. She is also a doctor of the church. Benedict XVI named her the 34th doctor of the church and the 4th woman to be a doctor of the church. So she was born in Germany, and stories say at the age of 3 she started receiving her visions where she'd see like a light, which was God coming to her. She entered a abbey in Germany at around the age of 8. She was brought in, and there was an abbess there that would teach her, so she learned the tenets of Christianity. She also learned Latin, which is important for the time, so you could write in Latin. And her writings, she has this large volume of works that are handed down, but they give us a picture of what medicine was like in the Middle Ages as practiced by a woman, which would be not the medicine that would be practiced by men at the time. So she wrote her visions down. The visions told her to write them down, and she had the approval of Bernard of Clairvaux and Pope Eugene III to write down her visions. And then she also formed 2 different abbeys for her nuns, which she was the abbess of. She wrote down her music. She corresponded with popes. She corresponded with emperors. I believe there were anti-popes at the time, so they called her the Sibyl of Germany, of the Rhine, kind of an instrumental lady at her time. She did read from the library, so she'd get knowledge from there. She also worked in the herb garden and the infirmary. So from her experience and from her knowledge, she wrote 3 books that you can still get, well, 2 of them at least you can get online, if you feel so moved. For natural science, she wrote one called the Physica, and it spoke about 9 categories of healing. And she went into the scientific and the medical properties of plants, of stones, of fish, of reptiles, and animals, how you kind of use these things to cure at the time. She wrote 2 books on medicine. One was Cause et Cure, and it looked at the human body, the connections to the natural world, the causes and cures of various diseases. And then when Benedict XVI made her a doctor of the church, this is what he said about her visions, but he called her perennially relevant, and an authentic teacher of theology, and a profound scholar of natural science and music. Hildegard of Bingen. Similarly around there, so in the 1200s, Pope John the 21st is not a saint, but he is the only physician to be pope. So he went to school, medical school in Paris. He taught at the University of Siena. He was the physician to Gregory X, and then his papacy was just a few months, less than a year. But he did write 3 books. One was The Poor Man's Treasury, a book of cures. I'm an ophthalmologist. He wrote a book on the eye, and he wrote a book on the soul. He is the only son, I was corrected, he is not the only pope in Dante's Divine Comedy, but he is the only pope in paradise. So this is the sphere of the sun in paradise, and he's pictured with the 12 wise men. It is Pope John the 21st. And he's better known as Peter of Spain, if you've heard that as well. To finish the Middle Ages, this was an age of hospital building in Europe. Again, that school of Salerno is the oldest. In the period from the 1200s to the 1500s, this is when guilds were formed for physicians, and the debate of should pharmacists be allowed in these guilds, are barbers. Barbers would be surgeons at the time in the guild. The church at the time did regulate the practice of midwives, and it forbid its clerics of higher order from shedding blood. So bloodletting would be a cure or a medical practice at the time, but it was a lucrative one. So the church didn't want its priests to profit from the practice of medicine at the time, so priests did not do that, or were forbidden to do so. Coming into the 1500s, you go through the Enlightenment, you go through the Reformation, and at the Reformation, Luther lamented that his followers found themselves believed they found their salvation through faith, and not their faith in works. So his followers did not have the good works that were found in the good books at the time. One of those we could say would be St. Camillus de Lellis in the 1500s. So he had a conversion later in life, older in life. But before he had his conversion, he was born in Abruzzi. I'm imagining in Italy. This is a time when the Turkish Empire, Constantinople had fallen to the Turks, and the Turks had come through Europe, and they were all the way up to Venice. They were conquering Europe. So he went to war. His father was a soldier, he was a soldier, but he wasn't kind of, the American soldier. He was more of a mercenary, and kind of had this life of vice initially. So as a soldier, you would fight, you'd get paid for being a soldier. If you leave, you spend his money on gambling, what have you. Need some more money, go back and be a soldier. And one account has him fighting outside the Turks at some point. So kind of his life as a soldier. Before he had his conversion, he did get an injury to his leg, so he went to live both as a patient but also as a servant of the Capuchins. He did have a conversion experience, so he entered the Hospitaller of St. James, and he did care for, it was the place for incurable cases, so he was a caregiver, and he became the director of the place at the time. Philip Neri as his spiritual director, and he saw kind of the lax care that patients would receive from their health caregivers, but also from priests. So he wanted to reform this order, and he had these followers to improve care for the patients. At one point, he's with his remains. You can see there's a cross which spoke to St. Camillus, and the story says that Jesus asked him, "Why are you afraid? Do you not realize that this is not your work, but mine?" He ended up leaving the Hospitaller of St. James. He became a priest, and he established the order of first regular ministers of the infirm, also commonly known as the Camillians. Philip Neri he broke ways with Philip Neri at that point because Philip was concerned that Camillus would fall into his old ways if he left his old order. But he did form this new order. And when they were approved as an order, they took their vows of poverty, chastity, and obedience. They took a fourth vow to serve the sick, even in danger to one's life. And they wore this red cross, you can see on his habit there, which is kind of the first red cross. During his life, him and his followers, they cared for the bubonic plague in the victims of that in Rome. They were credited with making the plague leave Rome. He had the first military hospital, and during his life he formed 15 houses and 8 hospitals. St. Camillus de Lellis. Going across the pond, still in the 1500s, St. Martin de Porres was a son of a Spanish knight and a Panama native in Latin America. His father left the family. He was raised by his mother and was not well off, so he was apprenticed as a barber, which would have been a surgeon, and he became a third order Dominican. He eventually became in charge of the infirmary with the Dominicans, and he ministered to Spanish nobles, he ministered to slaves. He's pictured with a broom. I don't have a broom in this one, but he would kind of do any task that was necessary. And the convent must not have been well off, so he would beg for alms for the convent. He would care for the sick. He would also care for the orphans. He established an orphanage in Lima. And in caring for sick people in the hospital, I think his place that he lived was too full of people he would bring in, so he had to send them to his sister off-site. He is the patron saint of social justice, and he also had a great love for the Eucharist. He would spend time in Eucharistic adoration. There's a story that where he was kneeling, caught fire, so there was this fire, but he's still there praying in adoration. This quote is when he was kind of ridiculed for caring for somebody that he'd bring into his own room and take care of him there. And he said, "Compassion, my dear brothers, is preferable to cleanliness. Reflect that with a little soap I can easily clean my bed covers, but even with a torrent of tears, I would never wash from my soul the stain that my harshness toward the unfortunate would create." This I didn't know, so in the 1600s, up to North America, Rene Lupo was a surgeon. So one of our martyrs in Oriesville, down the road, was a healthcare worker. So he would be from Europe. He worked as a surgeon in Orleans. He tried to enter the Jesuits, but he was not able to because of ill health. From Europe, he came to Quebec, so this is where missionaries would start in Quebec, but the Hurons, so near us, needed supplies. So Rene, he was asked, he followed other people, he wasn't the leader, but kind of a follower, going to Huron country to help the people there, specifically to serve in its infirmary. And were coming down to the Huron area, but they were captured by the Mohawks, which would have been enemies of the Hurons, and they were tortured by the Mohawks. And Rene was the first to be martyred. He taught a child how to make the sign of the cross, and the grandfather to the child killed Rene. So he's our first martyr and also a surgeon. Yeah, is there more story? Okay.
The sign of the cross, the English who were fighting the French, the English were obviously Protestant, had told the Mohawks that when someone made the sign of the cross over someone, trying to steal their soul.
This is why it was so damaging, why that he killed him, because he did that to his grandson. Interesting. There's Giuseppe Moscato.
Back across to Europe. So these are our two modern-day saints, Giuseppe Moscato and Gianna Molla. And to give you an idea of the church in the modern day, Pontifical Council in 2010 said the church manages 26% of the healthcare facilities. We have 18,000 clinics, 6,000 homes for the elderly and those with special needs, 5,500 hospitals, and 65% of that is in the developing world, not in the U.S. or what have you. So Giuseppe Moscato, 1880 to 1927, he gave an example of faith and charity in modern medicine. He was a physician, a researcher, an educator. He was the director of the Pathological Anatomy Institute in Naples and the head physician for Hospital for the Incurables in Naples. So he was the son of a judge. He went to medical school in Naples, but the school he went to at the time was an agnostic school. There was anti-clericism in the school, but he was a good student, finished school, went to the hospital, and in his practice, or during his tenure, he evacuated a nursing home during the eruption of Mount Vesuvius, when you've got a volcano going on. He cared for patients during the cholera epidemic. In 1911, he cared for soldiers during World War I. As I think we said, he left money with patients during a house call. He is actually the patron of bachelors. He was not married, and those rejected by religious orders, as Rene was. And so he taught his students how to practice medicine. And one of his quotes to them would be, "Remember that you must treat not only bodies, but also souls, with counsel that appeals to their minds and hearts, rather than cold prescriptions to be sent in to the pharmacist." Giuseppe Moscato. Gianna Molla, I think everyone must be familiar with Gianna Molla, but she was also in our century a patron of mothers, physicians, and preborn children. To her spiritual life, so she was a physician before that in Italy. She married an engineer, had 3 children, and we'll get to the end. But her life of prayer, she outlined her own spiritual program. She said, morning and evening prayer on your knees, Holy Mass, Holy Communion, and meditation at least 10 minutes, and a visit to the Sacred Sacrament, Holy Rosary. Without Our Lady's help, no one enters paradise. So she studied medicine in Milan during World War II. She went on to specialize in pediatrics. She cared for mothers, babies, the elderly, the poor. She wrote out a prescription pad. This is not the quote there, but she wrote something called The Beauty of Our Mission. And she said, in one way or another, everyone in society works in the service of humanity. Physicians have opportunities that a priest does not have. For our mission does not end when medicine is no longer of help. There still remains the soul that must be brought to God. Jesus says, whoever visits the sick is helping me. This is a priestly mission. Just as the priests can touch Jesus, so we doctors touch Jesus in the bodies of our patients, in the poor, the young, the old, and children. Jesus makes himself seen in our midst. Many doctors offer themselves to him. When you have finished your earthly profession, if you have done this well, you will enjoy divine life, because I was sick and you healed them. So Jenna Muller was a physician, but she went this period of discernment of what should she do with her life. I believe she had a sibling that was a missionary. She thought of going to missions. She went on a pilgrimage to Lourdes. She was the doctor to the pilgrims going to Lourdes. She came back and she told her friends, so she went to Lourdes and asked Our Lady, what should I do? Should I go to the missions or should I marry? And she said, I came home and Pietro came in, and Pietro was who she went on to marry, an engineer. There's a movie on Jenna Muller on, again, Form, and a friend of hers said when Jenna got engaged, she came up to the friend and said, congratulate me, I'm engaged. And the friend said, oh, is it Pietro? And Jenna Muller goes, how did you know? Which, now you'd be like, how do you not know who you're engaged to? But I guess at the time, just a different world. So she was married. They had 3 sons, a son, 2 daughters. She did have 2 miscarriages. And then they became pregnant with the 4th child, but she wrote to her husband, which if you read in books on her, she said after she had the 4th child, she would leave her practice and she would stay home with the kids. She said, even though that would be difficult to me. But so in the pregnancy with the 4th child, she had a tumor. And she said, save the life of the baby rather than hers. And this is a letter that her husband wrote to the Catholic Christians on World Youth Day. So her husband said about this pregnancy and what happened, you so desired to have another baby, and you prayed and had others pray that the Lord would grant us this wish. The Lord heard you, but this divine grace would also require the gift of your life, and you gave that very gift. You loved our 3 children no less than you loved the baby that was within your womb. Of that I am certain. For you, the motherhood of that baby within had the same rights as did the lives of Luigi, Mariolina, and Loretta. The right to life of that baby that grew within you demanded the complete sacrifice of yourself that you would have to give in such sad circumstances. You knew that the maternal care of raising, educating, and forming our children had no comparison. But in your humility and above all in the fullness of your trust in divine providence, you were convinced of not committing an act of injustice against our 3 children. You knew that in such a sorrowful circumstance, the one who needed you most and relied completely upon you was the baby in your womb. You considered no less your obligation to raise our children, teach and form them after their conception and birth. You did all of this ever trusting in divine providence, even if this new maternity would cost your life. Several days before the birth, with a firm yet peaceful tone of voice, and such profound emotion in your face that I can never forget, you said to me, if you must choose between me and the child, do not hesitate. Choose the child. I demand that you must save the baby. I understood, even if you had done everything to hide it from me, your pain of mother and wife in this dilemma. When such a choice would cost you so much, you loved our children, your husband, and life itself. How I trembled and suffered with you. So she did, the baby was born. She did pass away from an infection after the birth of the baby. She was canonized, and her daughter, the baby that was born, was at the canonization, I believe. But for her philosophy in life, she said, as to the past, let us entrust it to God's mercy. To the future, to divine providence. Our task is to live fully the present moment. And that is the end of my list. I hope this was educational. Yeah.
May I add a person in the list of your 10 saints?
Yes.
Particularly you are an ophthalmologist,
Yes.
Saint Raphael the Archangel.
Saint Raphael. I didn't know if we had On the angels, Lighthouse has a CD on the angels. There are 9 choirs of angels. He is in the archangels are the 8th choir of the 9. So he's one of the 7 archangels, so not the cherubim, the seraphim, the powers, the principalities, what have you. He's an archangel that stands before the throne of God. So the story is in Tobit in the Old Testament. Tobit's son Tobiah, he traveled with Tobiah, taught Tobiah how he could enter into marriage to Sarah without dying, as her previous husbands had all died. Came back to see Tobit, and this is where Raphael taught Tobit's son Tobiah how to cure Tobit of his blindness. Something with
a
a
gallbladder.
fish.
Gallbladder.
A gallbladder of a fish. And there you have it. St. Raphael.
And now he's the patron saint of medicine.
Yes, yes.
And what about St. Lucy? Isn't she the patron saint of eyes?
I don't know St. Lucy's side. But yes.
And particularly you are getting old,
It's
so you
right.
pray for
The
him
Italians
for
get
good
to
eyesight,
every
both
year.
physically and spiritually,
And
right?
then we have St. Apollonia, right, the patron saint of dentistry.
Tell me a story of St.
And she,
Apollonia.
something in her story, she was martyred and she had all her teeth extracted, and she did replace them. And so the picture is that if you look at her statue, there's like teeth and a pliers with her. And so she's the patron saint of dentistry, and there's St. Apollonia guilds around the country, and Catholic practicing physicians, and we actually practicing dentistry. And we have a group here in the Buffalo area. We're connected to Catholic Charities, and we do all pro bono work for anyone who can't afford dentistry. So they contact Catholic Charities, and then they contact whatever specialist the person needs for dentistry, and we provide pro bono.
So you're a dentist then?
I am.